Good morning, everyone. I hereby call this meeting of the 23rd Senate Standing Committee on Executive Appointments and Government Investigations to order. I will now recognize Mr. Devin Macaronis to call the roll of the committee in session.
Senator Selena R. Babauta,
Present.
Senator Karina L. Magofnia,
Present.
Senator Paul A. Manglonia, Senator Donald M. Manglonia.
Present.
Madam Chair, all members of the Senate EAGI Committee are present.
Thank you, Mr. Macaronis. Now that we have that out of the way, I'd like to take care of some administrative matters. First, we ask for everyone's cooperation to please silence all your electronic devices. And also, we are streaming live on the CNMI Legislature's YouTube page. And at this time, I would like to introduce to you the professional staff of the Legislative Bureau assisting the committee this morning. First and foremost, we have our Senate Legal Counsel, Ms. Antoinette Villagomez, our Legislative Assistant, Mr. Devin Macaronis, our Sergeant at Arms, Mr. Will Brandon Uggan, and our IT Assistant, Mr. Delbert Camacho. At this time, moving on, I would like to get a motion to adopt today's agenda, please.
So moved.
A motion has been made and it has been seconded. Are there any objections to the motion? There being no objections raised, today's agenda is duly adopted at this time. I will now call on Miss Amalia Shai and the nominee, Miss Glenda S. George, to please come and join us in the chamber. And Ms. Shai's role here is to formally introduce the nominee to the committee and to give us a little bit of her background. Ms. Shai, you may proceed when you are ready.
Buenas, half a day, Tiro, and good morning, Chairwoman Selena Babauta, and the honorable members of the Executive Appointment and Government Investigations Committee. For the record, my name is Amelia Shai, Special Assistant for Programs and Legislative Review under the Office of the Governor. On behalf of the Honorable Governor, Arnold I. Palacios, and the Lieutenant Governor, David M. Apatang, I thank you for the opportunity to appear before you today. I am here to introduce Dr. George. Dr. George has an impressive resume that highlights her extensive experience and dedication to serving the government and the private sector. With years of experience, she worked diligently to make a difference in the CNMI. We are confident that she is well prepared to answer any questions you might have to present her vision for the future. We kindly ask for your expeditious approval on her renomination to Healthcare Professional Licensing Board. Sidus Masi and Gilisao for the opportunity to introduce her to this august body.
Thank you, Ms. Shai. Moving on, I will now open the floor for public comments.
Oh, sorry. Good morning, Madam Chair and the members. For record purposes, my name is Esther S. Fleming, and I'm the Executive Director for the Board of Professional Licensing and the Healthcare Professions Licensing Board. I take this opportunity to thank the chairperson, Senator Selena Babauta, and her committee members for the opportunity to testify in support of the nominee, Dr. Glenda George, to serve another term for the Healthcare Profession Licensing Board. I would also like to extend my gratitude to Governor Arnold Palacios and Lieutenant Governor David Apatang for their confidence to renominate Dr. George, who have been representing all the regulated professional counseling. Dr. George, who expired on January 19, 2024, continued to serve on the Healthcare Professional Licensing Board as authorized in Public Law 15-105. During her tenure, she played a crucial role in promulgating the important counseling regulations, namely um, the addiction professional license, the licensed marriage and family therapist, finally, and of course, her specialty is the clinical psychologist. These regulations are essential for ensuring the quality and effectiveness of counseling services in the CNMI. Currently, Dr. George heads an ad hoc committee that is focused on reviewing and updating the regulation for licensed professional, basically it's known as the mental health, counseling, and social workers that are long overdue. These efforts and commitments ensure that NMI's counseling regulations are aligned with the national standards. By actively working on these updates, she aims to enhance the professionalism and effectiveness of mental health services in the region. It is apparent that Dr. George's workload is extensive, considering her involvement with multiple regulations on top of her responsibilities at the Guidance Counseling Center. However, her determination to improve the recruitment and retention of qualified mental health professionals in the CNMI remains her primary goal. This dedication speaks to her passion for the field and her desire to provide the best possible care for individuals in need of counseling services. In the years since I worked with her on several regulations and application review process, I have the greatest respect and admiration for her diligent and meticulous work in reviewing applications for licensing. Her integrity shines through her commitment to ensure that great effort is adhered throughout the licensing process. This dedication not only helps to maintain high standards, but also fosters trust and confidence in the healthcare system. Dear Madam Chairperson and these esteemed members of the committee, I express my unwavering confidence and support in Dr. George's ability to serve as a fair and impartial member of the Healthcare Professional Licensing Board. Throughout the years, Dr. George has consistently demonstrated her dedication, expertise, and commitment to upholding the highest standards in healthcare services licensure. Her diligent and meticulous approach to reviewing applications for licensure has earned her the respect and admiration of her colleagues, including myself. Dr. George's unwavering integrity ensures that the licensing process prioritizes the health, safety, and welfare of the community. I wholeheartedly request your favorable action on her appointment, allowing her to continue serving as a full-fledged member on the board. Dr. George's expertise, dedication, and steadfast commitment to excellence make her an invaluable asset to the board and the healthcare profession. Thank you for the opportunity and time, and we look forward to a positive consideration on her appointment. Thank you.
Muchísimas gracias, Señora Fleming. The floor is still open for public comments. If there are no further public comments, we will close that portion of the agenda at this time. Let the record reflect that the committee has received no letters in opposition of the nominee's nomination at this time. I will now ask Dr. Glenda S. George to please rise, and Mr. Macaranas will administer the oath to you.
Glenda S. George, you do solemnly swear under the penalty of perjury that the testimony you shall give in the matter at hand shall be the truth, the whole truth, and nothing but the truth. Thank you.
You may be seated. Thank you. I want to welcome you, Dr. George, to your chamber, and also thank you for your willingness to serve in a higher capacity, specifically as a member of the Healthcare Professional Licensing Board. Ms. George was nominated by Governor Palacios on December 15, 2023. Dr. George, these nominations require the advice and consent of the Senate, a procedure unique to the Senate, and these procedures are the legislature's authority to vet your nomination beyond your education and professional standing in order to determine or make a recommendation to the full Senate body to confirm your nomination or to reject it. And that is why we are here today. For the record, the Healthcare Professional Licensing Board was established by Public Law 15-105 in 2007 in order to protect the public's health, safety, and welfare from unprofessional, incompetent, unlawful, and fraudulent and/or deceptive practice of the healthcare professions, and to govern the granting and use of privileges to practice the healthcare profession in the CNMI. Each member of this committee has a responsibility to ask probing, inquisitive, if not exploratory questions to determine your qualification, your temperament, and more importantly, how your experiences and education are a fit to the position you were nominated for. In this hearing, we will be asking questions of vital importance to this committee and to the public in general. With that, I will give you an opportunity to give opening remarks to the committee should you choose to do so. You have the floor at this time.
Mm. Good morning,
Good morning.
Honorable Senator Selena Babalta, and Honorable Senate members of the EIG Committee. I first want to apologize for my voice because I've had a pretty bad flu and I'm just recovering. So if I'm not audible or clear, please let me know and I'll try to say it with clarity. I want to thank you for the opportunity to consider my nomination to this board. I have served in the previous years with utmost dedication, and I take this role very seriously because I take my profession seriously. Ultimately, it is for the the protection of our community and also to uphold the standards of the counseling profession. So I do want to thank you again for this opportunity, and I'm here to answer any questions. I will do my best to give you any insight or information that you would wish to know on my part. Thank you.
Thank you, Dr. George. We will now begin the question portion of the hearing. How long have you served on the CNMI Healthcare Professional Licensing Board?
I'm gonna say 6 to 7 years. I'm sorry, it's kind of a blur, but has it been 7 years? I think.
Okay.
Yeah.
And in the last 7 years, what has been your challenges in serving on that board?
Well, the immediate challenge that I saw when I was put on the board several years ago was one, we lacked regulations for some of the professions that we're already practicing here in the
Wow.
CNMI. So that was the first thing that we tackled. We were able to develop the regulations based on national standards. That was pretty challenging for me. At the time, we didn't have much resources in the region, so I had to reach out to um, our national resources for some assistance. However, we ultimately were able to get our addictions professional regulations created and implemented into law. And we also had very outdated regulations in psychology, in clinical psychology. We were able to do that as well. And we did not have regulations for counselors who specialize in marriage and family therapy. So we were able to also develop regulations for that profession. Uh, so currently, it's been several years, but it does take time to create these regulations because they're not, I mean, they become law and a lot of work goes into it. So now that we've tackled that piece, we now have the homework that the current project that I'm working on with an ad hoc committee was pulled by other professionals in the community who are also licensed. We are working on updating the regulations for licensed mental health counselors, licensed professional counselor, and social workers. So that was the immediate issue, was we can't regulate if we don't have regulations. And I figured that was the first thing we needed to do. And we're still working on that. The old regulations suffice for the ones that we have right now. However, I did receive some calls from the community because the language was, there was some confusion on there, and there was also just updating that we needed to do. So we should get that done within the next month or so. There's more, obviously, as far as the issues and challenges that we face at the board. Um, as a board member, the issue that I have been dealing with is, we have a small community. The needs and the demands for care are so great, and the capacity to provide that service is extremely limited. And so, you have this balance. You're trying to balance the scales so that, you know, of utmost importance is the welfare, safety, and the protection, right, of our community. So we keep that at the forefront. And on the other hand, we're trying to grow our capacity. We're trying to build our skills internally within our CNMI with what resources we have. So that has been very difficult because while we know we can do it, it takes some time. We've been working with NMC. We have programs there that we've been working very closely to build the RH program, as far as getting them the clinical training that's needed there. But that all takes some time. So those are all challenges that I've seen, but I have to say that I've also seen the light at the end of the tunnel.
Thank you. It's interesting to learn of the challenges and accomplishments of the boards because we don't, um, too often we don't hear any feedback from board members or anything. We just vet their nominations, confirm or reject them, and then that's it. They're off
Yeah.
to their own world. But it's interesting to hear, and I'm glad you're here to share your experiences in that. What are your aspirations for the healthcare, particularly the Healthcare Professional Licensing Board? Where do you see this board in the next 5 years, let's say?
So I would say that, as if we wanted to improve the board and the way that we function, at least from the counseling perspective, because we are comprised of different professionals, including dentistry and physicians and pharmacy, right? So we're kind of a unified board with different specialties. I think that for the counseling piece of that, to improve it, we would probably need a couple more members represented for mental health, because we people don't realize how many layers, many layers and subspecialties are within the counseling field. So if you were to, just the regulations alone will tell you that, for example, with the addictions professional, there's 4 layers within that, different levels of professional licensees, depending on your academic training, your clinical experience. So that's just addiction alone. In counseling, for example, you have social workers. Within social workers, you have the bachelor level, you have the non-licensed social, I mean, non-clinical social worker, and then you have the clinical social worker. So that's social worker alone. And so each profession has layers of specialties and levels of expertise. So it would be wise to have maybe at least one or two more uh, experts on the board who would provide feedback within their specialty.
I'm glad you mentioned the mental health profession, because we have, as a legislature, we've tried to assist in that, because of the lack of resources is what we're hearing, lack
Right.
of counseling services, because we have a limited pool of licensed counselors. They've had to come here, and we've had to pass the psych pack, or
Pact, yes.
and to assist them to be better able to accommodate their clients. Um, so, what role is, or is there any role that the legislature, other than establishing these laws to assist you in your profession, is there a role that the legislature can play to further the mission of the Professional Licensing Board?
I think as a legislative and, as a body, uh, for you as senators, and actually it's really a community issue as I see it, because um, we're all human beings, and we are all individuals with families who live in community, both each designated island community and
Mhm.
a CNMI community. So, we've, for example, I'll give you an example. We've had some very tragic incidents in the last few months, involving suicide. And the message I have to the community is, this is a community issue. For us to prevent a progression of our youth in that direction, and not just youth, but we see individuals in their 30s, 40s, and 50s who succumb to that. And the only way that we can make a difference is for everyone, not just in your professional roles, but even as your role as a parent, grandparent, a brother, sister, neighbor, co-worker. It really does matter that we are aware of this issue, of these issues, because it's not just one issue. It boils down to several things that are occurring, and it seems to me like it's starting to catch up, right? Things are starting to catch up with a lot of the challenges and difficulties that people have had to deal with, and the way that we would perceive it in 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 this small community that we live in is, we all have to pitch in, and awareness is the first thing, is really recognizing that it's an important issue, that we cannot put it in the back seat anymore. We've learned a lot of lessons from COVID, and that's a wonderful thing, but it it really shouldn't stop there. It has to continue to be at the forefront of everyone's minds, regardless of what professional roles we hold. And in this arena, I think it really is about laws, like enacting laws to protect the community, but also supporting laws, as you did with SIPAC. I happen to be the commissioner for SIPAC, representing CNMI, because I'm on the board. And it's a wonderful thing. We haven't yet taken off the ground with SIPAC, because there's still some other kind of groundwork that needs to be done before people can avail to these services, because yeah, there's just issues with that, but they're very much involved with helping rural communities get access to care. So introducing laws, passing laws, um, funding. I know that's probably not what most people want to hear, but I think that is always the challenge, is recruitment. Is, we have a lot of needs, but can we afford it? Is It always boils down to that. Um, but yes, absolutely. I look at this at a individual level, family, community, and just entire CNMI issue that we all need to take part of.
You mentioned about access to these services. So let me ask you, as the director for the clinical side of CGC, Community Guidance Center, how often do you do outreach, let's say, at the public school system, or for that matter, to Tinian and Rhoda?
Yes. I just came back from Rhoda a couple of days ago. We have so on the CGC hat, role. We actually have quite a large team, and within our team, so we have 7 clinics and one program that does nothing but respond to urgent calls. 988. If you're not aware, we have a line that is kind of a linked nationally to what's happening in the mainland. So if someone was having a mental health emergency, they would call 988, not 911. So that's the distinct. So we do have that program as well. They're not a clinic, but they receive calls and they handle urgent care. So going back to your question, as far as outreach, we have a team dedicated only to outreach. So we work very closely with the schools, and we partner with the schools because PSS2 has a pool of professional counselors as well. So we work with them, but we do have programs that are really identified specifically for outreach, community education. It's more kind of a larger public education and outreach centered endeavor versus the clinical work that the other programs are focused on.
And do you provide clinical services, counseling services to when the team goes out to do their outreach, or is it mainly just they're promoting awareness up there that these services are provided? But I think we need to bring it a little bit closer to them and actually
Yes.
provide services, counseling or mental health
Yeah,
issues. So
it's really interesting that you say that because um, in the past, prevention, their focus is really on education, as you said, outreach, and for it really brings awareness, and then from there, people are linked or they know where to go. However, it's interesting that you mentioned that because um, we're learning as we go, and I recognize that need as well. We were in Rhoda a couple of days ago, and what we did, and we returned with, now we're kind of returning with a lot of ideas of how we can improve and expand care. So, although prevention is really meant for more of educational purposes, sometimes people who are exposed to that information in that moment kind of decide, hey, I might as well talk to someone or reach out. So what our next step is to do more of that type of service, so that although the education is there, the ability to walk in or even know when we're going to be there for people who did not plan to engage, they they have that access. So we did that. We also do that, and we've been going to Tinian as well, um, but we haven't had that opportunity to kind of roll it into our current program. It's usually been crisis based. So when something big happens, we kind of formulate a plan and we, you know, go out there and do what we can do for that particular circumstance. However, kind of learning from that, and you brought that piece up today, that we can make that part of some of the routine things that we do, so that access to care is readily available when they know we're going to be there. And we do have people who travel to Rodantinian regularly within our programs as well. So we do have outreach, scheduled. But again, I said there's 7 programs and they're all doing different things within their populations that they serve. However, what you're sharing and we might be on the same thought process is, for people who are not even attached to any particular um, serving agency, we want to have them to have that access. So, for example, first liners, right? First responders, they're typically, they won't reach out to for help unless someone nudges them or things get really bad. But we want to kind of figure out how we can have that opportunity for them, so that, hey, they're going to be here on the last Thursday of every month. I know where to go. So it's that sort of thing, so that we can encourage people to reach out and not wait for things to implode or explode.
I yield at this time to other members to ask their questions. Is there anybody? I'll recognize Senator Donald Maloney.
Thank you, Chair, and good morning and congratulations on your reappointment. I just saw your resume and you've contributed 7 years of your time, and so thank you for your service to the Healthcare Professional Licensing Board. Dr. George, I just wanted to ask you, is it a requirement or is it uh, how do I say this? Is it done elsewhere where continuing education is done for these professions? And if so, is that
Yes.
something that the CNMI requires?
Yes, it is a standard. So in every profession and the regulations that we've created, we require CE units. So these are continuing education. Without the CE, they cannot renew their license. And
Okay.
they're in very specific topics. So, for example, if suicide care and ethics, every regulation has very specific topics that they need to be well versed in. And, those are always changing. So that is a requirement as well for them to ensure that they meet those.
Are parts of the CE requirement, can they be substituted for volunteer work or outreach work free to the community? Is that something that
Depending
can be
on,
done or is it being
yes,
done?
I think that's a great idea. I think it might be psychology, but some of the professions do allow for uh, credits to present, to do kind of community education. So that's in there for some of the regulations. In others, it's more kind of guided by knowledge base, like kind of. But I think that's a great point you bring about community service, because it also encourages people to get out of the office and do work for the community. But I don't think that particular um, piece that you brought up is included as far as community service.
Right.
Yeah.
Yeah, I mean, I just bring it up as a consideration so that we can kind of expose also our students to some of these professions. Just looking at the types of licenses that the board issues out, and looking at how many non-residents versus residents that are licensed are, there's a huge difference between how many of our people are in this profession versus how many we're bringing in.
Right.
I know Senator Jude in the past has introduced, and I think it's now law, the behavioral specialist
Mhm.
scholarship to
Yeah.
kind of promote students to enter into that field. And so it looks like we are short on some of these professions. I mean, we only have, I think, as of last year, 3 certified counselors, right? According
For
to the
addictions, we for example, to give you a perspective, as far as the CNMI licensing board, we have for addictions professional, we have one licensed provider who's full-fledged license in addiction services.
Yeah, and
Yeah.
so a lot of these professions are also being replaced, right, by telehealth. I don't know if that's um, something to also look into to see if
Yeah.
we can get more of our students into this field.
Yeah.
Um, right now we have 0 for midwife, and a lot of these professions, there's only at least one licensed profession in a certain field, and so how do we get our people into these field when that one person leaves, right? And we'll be out
Yes.
of professions in these fields. And Senator Selena brought up, some of these services pushed over to Rhoda and Tinian. I appreciate that question and the response that you've given, seeing as how, at least with the Healthcare Professional Licensing Board, there's no representation for islands, it's more of professions.
Right.
And so I hope that more effort can be placed into providing and making accessible the services to these islands, absent a board member or absent a representative from these islands. Um, Can you explain what your this most recent achievement that you've done in DC, the governor's challenge? Can you explain what that is?
The Governor's Challenge.
Yeah.
Um, Actually, I wasn't able to go on the recent visit, they, which was this month in February, but I did attend last year. And so the Governor's Challenge, I'm a member. The chair for Governor's Challenge is Joe Kevin Villagomez. He was appointed by the governor. He leads that group. However, we are comprised of several community members, including the legislature. We have veterans on this in this group. We have the Veterans Affair director on there, and several others, including myself. And really, the primary goal of Governor's Challenge is to prevent suicide among veterans. And there's other things that come with that to improve the system as a whole, but it really boils down to helping veterans receive help and services that they need, because the numbers of veterans that are um, committing suicide, especially in the mainland, is alarming. So this was a project that really spans the entire mainland. All the different states are represented in Governor's Challenge, including CNMI. And when we went there last year, we came up with some priorities that we wanted to achieve. And these different priorities are things that are kind of more long-term priorities that we want to have for our region, including things like screening for suicide at the hospital. So we want to have different catchment areas, but we've also been met with a lot of challenges with that as far as identifying veterans, and it's not limited to the CNMI. In our visit last year to DC, we found out that actually many of the states are having difficulties identifying veterans and having them come out to be part of the system. So that's the things, those are some of the things that we're working on here, is not only preventing suicide but also identifying them and helping them get the help that they need. So our 988 line in particular has a line specific for veterans. So anyone who calls who is a veteran, they don't need to be connected with the general line. We have a way of kind of expanding their service or giving them a more focused attention. But that's the main purpose of the Governor's Challenge, is really it's focused on veteran needs and getting them the help that they need as far as mental health.
Thank you. And you've mentioned this 988 line for magic emergency mental health services. Is
Yes.
this what would constitute an emergency versus someone who's just wanting to speak to someone?
Yes, so that is a good point. The 988 line was intended for a suicide line, right? Suicide
Suicide.
prevention. We want to prevent anyone who's it's almost like an emergency line, like 911. When you're at your peak and you need that help, it's right there. And it's actually a 24-hour line. However, in the CNMI, because we're still kind of developing and establishing our program here, it's more of a day line, but soon we'll be expanding to midnight. But after midnight, it does go to the national line. National line connects with us immediately as soon as they get that information. They connect with us here in the morning. But going back to your question, so it was intended for a suicide line. However, it really isn't meant for that, and most of our calls are not for suicide purposes. A lot of times we get people who just want to talk, and so that is our way of also preventing things from escalating, is having a place for them to go, having a safe person that they can speak to any moment of the day. But it is not limited to suicide, for sure.
And on average, in a year, how many calls are we getting?
We actually
You
haven't
know,
received too many calls. As I think it really comes with educating the public about our existence. But I would say like 30s in a month.
Okay. Do we
So
have
it's going up though,
a
it's rising.
do we have a local number for the non-emergency calls?
So at CGC, that's where we take the non-emergency. So if people wanted to, for example, have their child seen, we have a main line that's been in existence for a really long time. The community knows 323-6560. That's the regular line. But anything that's urgent, or if someone wants to just kind of talk to um, a trained professional, then they can call 988.
Okay. Yeah. So this 988, I don't know. I mean, how well is this program advertised or shared with the community that this is a safe number to call in terms of trying to seek help in an emergency situation? I don't know, just walking around, even if you walk into the clinic, I don't think you see anything where it says call 988 or trying to get that recurring number in your head, like
Yes.
emergency 911, suicide, or other health mental health emergencies 988. So I think maybe a greater focus should be placed on trying to get the public aware
Yes.
and feel comfortable enough to call this number when they need help.
Yes, thank you for that
Thank you.
feedback, and we will definitely boost the public awareness and education on
Yeah.
980.
Thank you. And one last question I have is, are nutritionists, would they be part of this, part of the board's certification? Is that a different profession that?
I've not encountered it myself. So you said no? No.
It's not currently, or we just haven't had anyone interested, or it's not just part of this licensure program? Or should it be part of the healthcare professional licensing board as a licensed profession, or?
It's not in the statute that requires us, although some of the professions that we do regulate or just recently promulgated are not necessarily part of the statute that created the office. Nutritionists pretty much preventive. I think public health should be the one that should go out and really pushes for that, because they may be, like the public school, they try probably to get them licensed or everything, but it's a little bit different with,
Let me interrupt for a moment. We now have the live feed, so I will switch us to broadcast live on Facebook and the local channel 23. We are now live. Go ahead.
So it wouldn't be part of the healthcare, even if we were to consider. It's not a profession that falls within the occupations that are licensed under
we
this.
do need, I think, nutrition, because a lot of issues that are occurring within family, diabetic and stuff, they
Right.
all come out from, the lack of education in nutrition.
Right.
And the balance of what we have locally. But whether healthcare professionals should be a part of their licensure, really, it's personally for me, the experiences that we do have, it's not really as important as the current one, where we handle a lot of the medical part. Those that really do have in hospitals, the operations of hospitals, to ensure that,
But this could be part of the social, more of the social science part. I mean, I'm not too familiar, but then nutrition and just health in general, based on the nutrition part of this could lead into making sure balanced diet and stuff like that, which will lead into self-care, self-esteem, and so on and so forth. But professions like these that are not in the statute maybe could be something that the healthcare professional licensing board can recommend to include, even if it's not something that's listed, other professions that are currently not listed in statute could be recommended to the legislature to include it, or and so I hope that maybe that's something that the board can look at the all other professions that could be part of your program that could also help generate what very little it may bring as a licensed profession. Um, so thank you for that, and again, congratulations on your nomination.
Thank you.
Thank you, Senator Maglonia. I recognize Senator Karina Magofnia.
Thank you, Chair, and good morning to you, Dr. George. Congratulations again on your renomination. As you have explained to us earlier, there is limited resources as far as professionals to be able to assist in providing services to the rising numbers of different types of issues that come up, right? And I was curious whether or not the board, not the board, but the office itself has done outreach programs to, like, let's say, like high schools, to almost kind of like recruit the youth, but more so give them information, and provide some kind of exposure as to the different types of professions that are needed here in the CNMI, so that should they be interested, there's some kind of program that kind of takes them from step one, how to, what to do in high school, into college, and just give them a roadmap really to what they need to do from where they are now to the professionals that they need to be. Is that something that the office and like maybe PSS has had conversations to see how we can better promote, the need for professionals such as yourself and other professions, so that we can increase, build the capacity, right, to be able to help with the challenges that we are faced here on a very remote island.
Yes. Thank you, Senator. I think that's a great point that you bring. I remember, growing up years ago when I was in high school, it was like one day of sitting in someone's desk and experiencing that, and it kind of ended there. So, what you bring to this, as far as more of a long-term nurturing, fostering, and providing the roadmap for young individuals to really understand what the profession is, and if it sparks, an interest, and they know what to do and they know how to prepare themselves for that. So what we have been doing is we partner with other agencies, including the schools, when they invite our team to present or talk about our experiences around how, what our footsteps have been leading to where we are. So we have been contributing in that way.
Okay.
However, what you share is taking it further and embedding it into something within the systems where these students are at. And I think that's a very good point.
It's almost like an annual fair, right? Like in
Yeah.
and a lot of high schools on the mainland, they have these career
Yeah.
plans that they have annually at schools, and professionals such as yourselves would come to these schools, talk about what they do, and you'd be surprised how in tune, especially are these generations now. I mean, yesterday we had a public hearing on the tax bills that were introduced from the House, and we had a good number of youth
Yeah.
that came up to share their sentiments and comments about the bills that they were either in support of or not. But it's amazing how in tune they are, and especially with regards to suicide. I mean, a lot of them have been affected either directly or indirectly, right, because of the growing number
Yes.
of this issue. And so maybe they're just not aware or familiar with the types of professions that are out there to help the community, right? But more so, how can they themselves avail of these programs and provide them with a roadmap, so that because I think when you talk to them one on one, it they have the compassion and the passion to pursue that. They just, a lot of them don't know how to get started.
Right.
And I think that by providing that kind of awareness and a system, and it's annual, right? So if they're exposed since freshman and then sophomore, by the time they reach their senior year, they would probably have a better idea what they want to do. But just giving them that access of that information allows them to start thinking of what they would like to do as an adult when they get out of high school, and how they can provide service.
Yeah.
So that's just something to consider, maybe working with PSS and the college to see
Yeah.
how they can create programs for our youth to, and that would help build the capacity that this office is looking for. um, I was looking at the citizen centric report for 2023, and I see that there are several initiatives and priorities listed on there. Three of them kind of caught my attention, and I just wanted to get a status update on them if you could provide. One of them is the direct online payments for licensing fees. I believe in the report it talked about the initiative was to work with Department of Finance to create and implement a way to register online. Are you able to provide us some status on that?
I think director has been taking the lead on that sort of thing.
Am I allowed to?
Is
Okay.
You're welcome to.
It's a good question, and I have some good news.
Yay.
The board is going to hear it next week, Wednesday. Um,
Hear it now.
well, those are, I told her when we first came. I told her when we first came on board that these are very smart committee. The last time I was here, they had all the right questions. And so I said, "But believe me, they'll ask you about counseling." And I'm glad, because sometimes they ask a doctor about pharmacy or and stuff like that. So they know how to play too. Anyway, the question on the initiative that we started out with online and try. I have major issues because a majority of our licensees are maybe good 85% are from off island. And they usually, when they apply, whether that would be for initial license or the same thing with Board of Professional Licensing for engineer, architect, and so forth, um, we don't have, and even if they go, I mean, they can't pay online. That's the modern approach now, mode. And so they always have to write, personal checks. It was even worse, got picked up during the pandemic, because they have to go get cashier's check. They have to get up in line, and not all of them can be able to get in. It just too intimidations, just thinking about going lining up at the post office for cashier's check, and even trying to mail FedEx their payments for their license. And so I've been working with, since I came on board, we cannot continue to have to work like this, where they have to do FedEx to send their checks in and stuff. So during the previous administration, they all kind of started with the um, govern, the govern, the online system. It's a data management, financial management system. As we start exiting into JD Edwards, so I did discussed it with the governor for a chance also for us to be included. Healthcare and professional licensing has always been, we're usually the last. I have to ask what was happening at Aqua Resort when they introduced the program. And he goes, "What do you mean you're supposed to be there?" And he goes, "No, I didn't know anything that now we're going to go online to make payments or applications." It's the latest thing now, where uh, networking, especially for permitting. And that has always been a forefront for me. I'm more of a computer person, making things efficient and getting people to really just do it right on wherever you are. And so when that thing didn't work out, I go, and we were close to finishing. We got applications that we were going ready to launch. The biggest issue is money, because finance would not or is not ready to accommodate, for example, healthcare, because we pick up a lot of payments there. Or they go to make the payments, but those that are coming in the mail, we have to help them out and pay them at the treasury. And so that went out. They're no longer there. It wasn't until I was sitting in with Tracy, Secretary of Finance, in a CCD training, and I go, Trace, honest, I really need help. When are we going to activate online payment, and all the way down and finishing it to application? Whenever I go off island and attend national council meetings, they are quite amazed that we're still issuing check, and goes, those personal checks are obsolete. And they tell me over the phone on that, and he goes, and we cannot be there. Why can you work on that? But I have to work with the government. And recently, Tracy was able to connect with me on local gov. I am very happy. We're ready to launch anytime now on what Tracy called quick pay. At least that. They can email us their application, whatever it does take, but the payment is all they're looking for. So that I had to call finance 10 times. Is there an issue? Can I help? And it's man reluctant to give accounts and stuff, but they trust this local gov group that they can work on. I swear this is one of the best one. I didn't have to work as hard like when the other company was here, but she did most of the work fast. It only took her maybe 2 weeks, 2 to 3 weeks, even to work on the application so people can start applying online. And when they come to us, it would automatically we review to make sure that they're in compliance to the regulations. We push it out to all the different board members for them to review and approve it. Comes back to us. Once it is approved by the board, and there's only 5, then they can print out their own license. It is, and I'm quite happy with that. Next week, we're doing a Zoom meeting for them. I asked them if they can help me to explain to the board how's this thing going to happen. And I hope that we were supposed to launch it last week. But with all the things happening, I understand. I try not to get them upset. I can be pushy, but I'm not the priority right here. But it would alleviate a lot of the paperwork things, and especially the transactions on the monetary stuff. It would just go directly. It's easy to accommodate. Munis is a blessing. I know that JD could have been accommodated with that. It's just that the training was never there, really, as an SAA, and I worked for 11 years at the very top of the government, so I know how that thing works. So, but the local gov is there. It's worth having it. I'll probably be the first one to be accommodated with online payment that is not paying taxes, because that was one of the first question is, how you're a little bit different. You don't pay tax. And he goes, no, this is not tax. This is fees. And everything that I do is from off island. And so we need to accommodate that. And these are very busy people. You're talking about physicians, dentists, pharmacies, clinics, they're all over. The report on the centric report, maybe good 85% are off island, and they're looking forward for this to work out. So I hope it helps. It will be there.
Well, that is definitely great news. And, some progress is better than no progress. So I'm glad to hear that. And we really do need to adapt to the changes in technology, right? And be a lot more efficient and effective in the way we do things. As you have stated, and even on the centric report, a good percentage of that are from people on the mainland. And so we need to be as accommodating, because when the pandemic happened, that kind of put everything to a halt, and to be able to require them to go to the post office and get cashier's check, like, even the whole world was literally at a halt. So we need to be able to adapt and have some flexibility, but really just adjust and get with the times, right? So I'm glad that you've been pushing for that, and I'm very happy to hear that our Secretary of Finance has been able to assist in expediting that process. Um, I don't know. Maybe if you want to just sit there, because the two questions that I have are from the citizen centric report. So, one of the other initiative was the data management system, and I believe that was to configure the application process, which is probably what you just explained. Um, and so maybe that you've already answered that part of the data management system, unless you
Especially
want to
when we do a
elaborate.
lot of statistics, and the centric report is all stats. Um, I do this manually on Excel. And so, just manipulating the data, it's not easy, takes me a while. I love numbers, and it's just very frustrating.
Yes.
So local gov will certainly, as I start processing this one, um, those questions so that I can generate a report. It's all for centric.
Okay.
Yeah, and I'm an educator by profession, so
Yes.
I really enjoy doing centric reports, as that makes it a lot easier. These are really for the community base.
Sure.
Who doesn't read, they just want to look at graphs,
Yes.
whether the money is high or it's down below, and it's easy to grasp. We don't have time to read.
Yes.
Yeah.
Well, thank you for putting together the centric report. It really does help us get a good idea of what's going on in that area. And the last question that I have, Chair, is the on-site inspection for compliance and to investigate complaints as they come in. Um, According to the centric report, there's an investigator position that is still vacant. Is that still the case as of today?
Zeroed out in FY24. Let me, and I know you did ask Dr. George. I That's one of the priority that I have right now, and I met with the governor just 2 days ago. Um, and I did ask, and I go, and I left it. OMB could have left it with a $1 in there, but they took it out. It was one of those. I got caught in one of those. Anything that's not filled, take them down. Okay, and I realized we don't have the money to pay for it, but at least don't close. It's a civil service position. And our previous investigator died. And so I never get to fill that position for the reason that, he was, even though he was on sick leave, he was also taking down his sick leave and annual leave to finish the fund. So I needed to know how much would that cost me. I didn't have enough during the time that he was out. Now, when I submitted FY24, um, it was fully funded, but they cut the hours because the money was not there. So they started cutting us a lot. And that kind of helped myself and my secretary, my admin, to alleviate for us to come in even during austerity. So I couldn't fill that up because the funding keeps going. I mean, I need to work and I need to get paid too. If I hire somebody, maybe that would only be less than 15,000. I need an investigator that's a little bit mature, that is not scared to go out and visit. It's one of our major problems today, that we have not been going out to investigate some of the clinics. We hear a lot of stories that you don't want to hear, including construction businesses that we need to ensure. Um, the issue that we have is when there are complaints, they can easily call us. We ask them, we'll help you write the complaint. Is Mrs. Fleming, do I have to go to court? Maybe if it goes, but sometimes we go just to the hearing and you go, no, then I don't want to write. I don't want, but I want you to know that this is what happened to me. A lot of those things are happening. I did ask the governor, please, if you have an extra FTE for now that I can bring in. We are at the mercy of the Attorney General's office investigators. So whatever complaints that we have I forward it to the Attorney General's office because they do have. But then, of course, we may not be a priority. It's a different department, but they're the Attorney General is more than willing to help us. Uh, they evaluate the complaints. Our Attorney General, our legal counsel is from the Attorney General's office, so it kind of alleviated us pushing for some investigations to go on. But I'm putting him back, and it's one thing that I would like to ask when it's time for you to review the FY25 budget. If we can put that back in, I would like to leave it at a little bit higher uh, than the ordinary hiring of less than 20,000 because I need people to be trained. So because a lot of the write-ups will probably end in court, so I cannot have
Sure.
anybody that's not fully trained. Yes.
I
Thank you for
understand that
asking
you
that.
probably can't disclose what are some of those complaints, but can you just give us a general idea of what types of complaints you guys receive? Because I'm asking this because I'm starting to think like maybe there's a way to do an MOA or MOU with other agencies that are somewhat related, right? But because you are lacking that resource right now in the interim while we're trying to find the funds for the FTE, if that's something that can be done at
Yeah.
this time. So can you just give us a general idea of what types of complaints
The
you-
most that we get that is picking up is dentists.
Okay.
We have one case that's we've done the hearing already, and he's being monitored quarterly for the practice. We did not, it's a lifetime people just needs to be.
Got it.
We have to understand where they went to school. That's their livelihood.
Mhm.
So, but as long as we monitor the practice, it's fine with the board. But most of the complaints that are coming in is tooth extraction. Recently, a couple of days ago, they told me that they had a picture of somebody's doing artificial tooth, the todo manito.
I highlighted it.
The guy's not licensed. First, he says, "I think he was on drugs," and I go, "Oh shoot!" And I'm trying to get the person who told me, which is a third party already, if they have any evidence, pictures, and he goes out. She emailed me the pictures, and she was very upset. This guy that we're monitoring right now came from one of the tooth was extracted, and she started bleeding. It was so painful for her. The guy just thought it was going to be okay, but it didn't turn out okay because the procedure that went through was a reporter.
Oh, okay.
So
So I'm just curious, are dentists required to have licenses to practice here in the CNMI?
yes,
Okay. But this particular person is not licensed?
the one that's doing the
The teeth.
teeth,
So
the
just doing it
artificial
at a
tooth.
like at their personal residence or
I heard he's not licensed to be.
but he works at a dental place. But he doesn't have
Now I
a
just need to find out where
Okay.
that dentist is.
okay.
Yeah,
And
but
ma-
those kind of thing, I
Absolutely.
cannot wait for
So this is
an
even
investigator.
more crucial for an investigator to be
I
on board
need
so
an
that they can
investigator
actually
right
go
now.
out and do the investigation
Yeah.
to ensure that the professionals that are
Protect that community.
providing that type of services are indeed licensed
Yeah.
in the CNMI, right? And because there has to be some protection for our consumers. Like you can't just and
Yeah.
once they touch you, it's
And we understand when there's issues, they're not God, just like any physician. And but due diligence on their part, they really need to
absolutely
to take care of that one.
Yeah.
And so what happened is the only way for us to catch is when they cannot fix it. Then usually the patient has to go through either the hospital, and that's the best part is that our dentist is a board member from there.
Okay.
So she catches up on a lot of those
Okay.
things. But that is a major, the dentist practice here is,
Okay.
we need to really do a lot more
Okay.
monitoring on them.
I mean, and you think one investigator is sufficient to assist with the many complaints, or how many complaints do you guys get on the average, let's say per month?
Oh, no complaints. Maybe a year we'll probably get one or two. That is if we push to, and we'll help
Because
them
they also
sign
have
it
that
up. But
hesitation
yeah,
to
it's
to
hearsay. When
yeah,
we meet, they tell us, but we cannot really bring it for a hearing if it's an anonymous, even an
sure,
anonymous, they have to sign for it.
sure,
And we try to coach them that it will not be a big issue. Don't be scared about it, but it's important because, they go to, what about if it's another patient again that they're doing it?
absolutely,
And it's
absolutely,
preventable, but we just need to make sure that, even though we're in the islands, uh, practices like that, we had to protect the community.
absolutely, I agree. Okay, well, thank you for sharing that information. That's all I have, Chair. I yield.
Thank you, Senator Magofnia. Any other members? Recognize Senator Paul Manglona.
I'm just gonna keep it short, Madam Chair, because I know she instructed us to end this by 11:30, and I guess Senator Donald and Senator Karina finished my time, but that's okay. Good questions. I also want to congratulate you, Dr. George, for all your past services and for accepting this challenge again to continue serving in the healthcare profession. Um, I am so impressed by your background, your education, your experience. So we're proud of you. No, so actually, I just want to ask one quick concern here on Medicare, because Medicare in the Philippines, for example, is not qualified, right? I understand. So does the healthcare profession board have any role if we try to explore this possibility? Because I believe uh, Medicaid or Medicare in Guam is qualified in the Philippines. And I mentioned the Philippines because of St. Luke and Asia Medical, where a lot of our patients go there over the years, and so maybe some of the concern are the professionals, right? The doctors being foreign doctors, um, but nonetheless we send our patients to the Philippines. Is this an issue that is ever discussed in your board? Concern?
No, we have not discussed Medicare or Medicaid issues at the board. Um, I wish Dr. Marty was here because he would probably be more versed on that. CGC, as far as our services at the health center, we don't, 99% of our services are free. So there's no need for payment for at this
Okay.
moment.
I'm
But
thinking along the
Medicare's on
line
the
of
medical side, they
did
do.
you say medical side?
Yeah.
From sa mamura, no?
Ungan.
O sa bisangan na taginin na gwaji na patients po fanano pa Hawaii or America lo tisinya manono sa tauza country giza
Ungan.
Hawaii tinaw tisinya man meet na sa man afazi full siya sinya manono pa Philippines sa matsuchulia I Etna, right? Sinya Etna or other na insurance low ang qualify lo ki Medicare di sinya Medicare accepta giza Philippines. So if we're to explore pat check, is that an area that you can help as a health profession na board na no sa amzu mo lalay siya the yet we allow our patients po fanono guatu fan matreat lo afay Medicare na munga siya na umausa din na insurance no kasi udanya i Aetna and i Medicare. So how do we approach that? Who is CACC only, or does the healthcare come into play and say that we can verify St. Luke and Asia Medical or Medical City, na their healthcare meets our standard, and that's a role maybe that you can play.
Yes, Senator. Este Medicare and Medicaid, basically Medicare would be one. They're a little bit more stringent in their regulations. Para u fan malaposi, Medicare at a foreign hospital, debi ano fan ma-certify i doktor niya before they can make reimbursements or they get paid. Za i utungan na megay gi the Philippines, Asia, looks Guahasya megay totoo niya ni man US certified because they always go back to serve their country so many hours or days. It's part of their citizenship, I guess, and their benefits that they get, even though they are not staying there anymore. Lo i-medicate no for us to license, there is a pathway already. It's a statute that it's in the regulation. Megay biyay na i-legislatura man mamamaysin tanafan Hanoi patient para Philippines often at sinan no tanafan mo tumagi to practice here. Purusi sa lapi ne za jangin para ta na fatuni ti qualify gito ta standards. Pues man problema hit siyempre ne sa i-medicate umapapasid za that sa US funding. So lu man malisensya lo they have to meet the qualification. They have to meet the requirement in the regulation.
Mas izo ko concern dyan gayigi patient sa no matreat gi sa equipment and advance yan na.
Guahapagu, in fact, I'm meeting with some foreign physicians that uses a special visa in the US. They, it's hard to fill positions. Giza Americane. They are physicians, but they are not in the hospital. They don't practice, but they teach classes through the university. They see some of our patients because it's one of the things that
You
they're
have to
asking.
license them when they come here?
They actually they plan because they're high level. They're high level people, but they want to follow up with the patients that they treated in Los Angeles or in Sharp, San Diego. And so in order for them to do that, even if it's an online consultation, they wanted to be able to be licensed sa tisina man mapasi zang kinti man malisensya ne. Za visa, it allows that. California is very unique. They allow for that. It's a special visa for them. Man malisensya ni Board of California, Medical Board of California.
Okay,
But it's only a certificate, not a license.
Tizaw na by pulong law. Sinata continuous activity na discussions ajuda fa nam neji temano pata check isti Medicare and gi the Philippines and gagista gi St. Luke or Asia pareji man na medico gi sa istama malalay sunsa gi sa US no pera di gini. Just finally befaisin namju often naman separaw i nursing boards and healthcare board. Why could that be under one board?
It has always been, I don't know, it has always been separated.
Quanto dyan staffing in nursing board?
Oh, I don't know. Carol, maybe they probably have 3 or 4.
Sa professional healthcare, I know say nursing. I'm just wondering,
Yeah.
actually, watan revenue generating na ididi para nursing board. I don't know if I see on the numbers, watan kusina si nadanya anyways and healthcare law. That's also something for the tapangikintus. Talsa benakarada sa chair no hearing.
Just so I know that he's very interested in this foreign thing. There is an ad hoc committee that the chairman of the healthcare have put in together, and this is to revamp EDE, to try not really revamp, but to try to insert some kind of special visa to be able to be licensed with us. So that one we have it's just ongoing paggumatututun siya, and they're gonna try to make it a little bit more easier for that después they cannot come back and monitor or follow up with their own patients. But I hope that change would accommodate some of your concern. Yes.
Thank you. Thank you, Senator Paul. After hearing all of this, my only, I guess, recommendation would be to consider with having access to, let's say, counseling services or whatever mental health counseling is available. My only recommendation is to consider those who are hard of hearing who can't utilize the 988 system. And I know it's difficult to accommodate all disabilities, but I was just thinking about that when we were in discussion here. But other than that, Dr. George, do you have any parting words for us?
Thank you so much for your time and
Thank you.
for your insight and feedback. We will take that information and put it into use.
Thank you also for coming out here and have this dialogue with us. You are hereby dismissed.
Thank you.
With that, this committee will stand in recess. It is now 11:35, and we will return at approximately 2 p.m. this afternoon.